Hi, so I'm Emma Williamson, for those of you that don't know me already. I'm a clinical psychologist and clinical lead from South London, the Maudsley. For around the last 8 years or so, we've been pioneering in PIEs, embedding teams of NHS psychologists inside homeless hostels, originally in Lambeth, and now we've grown to cover Greenwich and Westminster as well, and really thinking about health's role in housing and the underpinnings of why we need to place our mental health awareness and trauma back at the centre of our thinking with this population. So we're working both to work in partnership with the third sector by embedding NHS psychologists available to work with the teams, but also then thinking about how we work on the pathways and referrals and access from inside the system to really help tackle like some of the things that Duff was talking about getting people access to appropriate services and timely intervention. I am talking later this afternoon with Nick Maguire on some of our data on our project, so that we're not going to talk a lot in this session about the data, but we've got a really exciting data set on the trials that we've been doing in Lambeth.
Grant.
Hi, I'm Grant. I'm the Evaluation and Learning Lead at Opportunity Nottingham, land of Robin Hood. Actually, apparently you look at his housing status, Robin Hood was only a part-time rough sleeper. In the winter he actually used to go back to his village. My day job at Evaluation and Learning is actually all around the economic kind of stuff. The Opportunity Nottingham is one of the Fulfilling Lives projects. We work with people who have multiple and complex needs. And actually, if you look at the economic stuff, the biggest savings actually isn't in health, makes some difference, but it's the criminal justice. So what you all need to do is send your bills to the Ministry of Justice, and then we'll see some change, I think. And yeah, I'm just an enthusiastic amateur about PIE. I discovered Claire's guide, and I've worked in homelessness services since the mid-1980s, and my only regret is I didn't know about the psychological approach and how effective it can be earlier, really.
You've got it now, Grant. That's the main thing. That's the main thing.
Never too late.
This is me, and I am really passionate about PIE. If you cut me, you'll see rock. I'm like rock. You'll see PIE going all the way through. I really believe that we all need to be psychologically informed in the work we do. It not only helps us understand ourselves, but the people that we're working with. So the aim of this workshop really is to, because increasingly, which is great, more and more services are becoming psychologically informed or trauma informed, but as we know, there's always challenges to implementing new ways and approaches of working, and we really want to look at what those are, because I think sometimes that can stop us from doing it. And we're also going to look at very briefly at what some other areas across the country are doing. So that's what we're going to do very briefly. So just a reminder of the key elements. Can I just ask by show of hands, does everybody know what a psychological informed environment is? No. Marvellous, great, okay.
Nearly,
so,
not everybody.
Okay, so the majority of people do. Basically, there are 5 elements. 4 of those elements are key to any situation or service. This is where the difference is. To be a psychologically informed environment, you have to have a psychological understanding or approach to the work that you do. That's the key difference, I would suggest. The reason why this is becoming so popular, and we just hinted on it there, was because we're recognising that so many people that we come across in our services have experienced trauma in their childhood. Okay, lots and lots of research and studies that are reinforcing this, and I think we've always known that terrible things happen to people. We haven't always known what the impact of that is on their behaviour, the way they engage, their attachment, all of these things that will influence whether someone is going to engage with services or not. I'd like you to do a very quick exercise. I'm just going to give you a minute to do this. Just talk to the person next to you, and if you are implementing PIE or thinking about implementing PIE, what do you think, or what are you finding are the greatest challenges? Just identify it, because I'd like you to hold it in mind as we go through, because we recognise top 5, okay? Or be thinking about what learning you've got that maybe you can contribute to the discussion we're going to have. Would people mind shouting out some of the things that you've been talking about? What have you identified as the key challenges?
Training.
Training, yeah.
Well, I was going to, maybe 2. So one of them I think is for staff it can feel like they have to change. They have to relinquish power in a certain way, and they're used to maybe dealing with people in a more authoritarian way, and because a lot of people have problems with boundaries and rules, and they feel it's their job to make sure that people stay within certain boundaries and rules, and so they take on a bit of a kind of parent role, and then to work in a more high way, they have to relinquish some of that, and that can be quite difficult, even if conceptually they're kind of on board with it, but just addressing some of the ingrained
It can be
habits
scary,
they
right?
have.
Someone's shouting in your face and you're saying, "Oh, what's wrong?" rather than "Don't talk to me." You know, immediately your natural fight or flight will kick in, and
people have a lot of ingrained habits as well.
Yeah.
So even if they kind of get it on the conceptual level, these kind of habits can still kick in.
Absolutely.
And then the other one I said is maybe with environments, because to change environments to make them fit for the physical environment, to make it physically more appealing or welcoming or whatever, often requires investment and money that may not be available. So,
Absolutely. Lovely, thank you.
So I think staff doing experience that as de-skilling as well. If you spend 10 or 20 years developing what you think is maybe they're completely inappropriate. There's a sense of I've got all these skills and now I'm being told it's all wrong. I think that can be quite difficult to negotiate.
So,
I think it's just echoing that. My experience at times is it's like going into St Paul's Cathedral and sort of trying to introduce the concept of Islam as a way of thinking about it. We've built the church. We're quite committed to it, really.
yeah, absolutely.
I think, again, resources, I think, to do PIE properly in terms of, staff needing good reflective supervision and that kind of thing, that with cuts to things like supporting people, that is usually the first thing to go. So, and what I've seen in my experience is that people think PIE is a pick and mix. Or, I'll just do this bit.
Absolutely,
and then we've kind of
absolutely.
done it, rather than seeing it in its totality.
Yeah, the psychological approach is what makes the PIE, definitely. Lovely. Other things? Shout out, anybody?
You go first.
I was just saying, I think also it's, I really echo what you said, but in addition to that, it's people also accepting that, thinking that they're taking risks, for example, bringing down a barrier, and that barrier is really, we know there's evidence to show that will increase altercations and increase feeling of separation, and yet bringing it down, people say, "Oh no, we can't possibly do that because then we'll be assaulted." And I think so
physical barriers within the environment, but also emotional barriers
and emotional barriers. And people feel they're too vulnerable to let down.
Risk aversion.
Yeah, I think it's an investment in staff, really, the approach, and I think unless you've got that investment, it's difficult to develop the approach in services. And I think the other resource that's really needed is time. Staff need time to be able to work with people. Because it's about building relationships.
Yes.
And unless you have that time, and then the time for the reflective practice as well, you're not really embedding the whole PIE approach.
Absolutely.
And then there's the relationship with external agencies, because you need them to be able to work with you in a PIE way, to be able to sort of, improve the outcomes for the individual. So, it sort of starts small, but the real challenge is trying to make it grow within services.
Yeah. Okay, two more? Shout them out.
Sorry, it was just to elaborate on the sort of basis of what is. It's interesting to think about what we could do, but I think you really need to pay attention to what is already there, because it's not trivial. I mean, the things that hold it in place, things like, the training I went through teaches you very clearly about what people have, what you're going to do to them, and how they're going to get better. And that if they don't do that, the problem is located in them, not in us. That they are not doing healthcare properly, they're not doing psychology properly, they're not doing housing properly, they're not doing the drug service properly. It's their problem. We need to engage, because it works for 85% of the people. They come on to mental health services, they go to drug service, they go to housing services, and they make use of them. So this group of people who aren't making use of them, it's very easy to locate the problem in them.
Absolutely. Blame someone else rather than our own behaviour, because I think that's our key problem. We ask people to change their behaviour every day, but when we come to actually change our own, I think that's another thing. These are the 5 things that we identified in Opportunity Nottingham, didn't we? We did a survey last year, because you've got a real sort of dedicated programme to implementing PIE.
We came and you came and you did that work, didn't you? We picked up a lot of this, that we had the framework from the guide, and it was, well, this is all very well, but the reality is that actually we are working with people for a short length of time. The austerity is kicking in, and people think, oh, we can't possibly do this, let's just give up, it's beyond us. So we were trying to drill down into that and see what we can do.
So do not worry, everything you've mentioned and more, we have a solution to, which is the key reason for this workshop. Emma, take it away.
Just to go back to the psychological approach, I think that's really crucial, is thinking about where you're linking to various sources of support and resource, so that you can have that kind of coherent psychological framework, because it's not, my team are a team of psychologists, and so the Hostels, we work with about 10 to 15 homelessness organisations across over 20 sites. So those sites get, we recognise they get a privileged amount of access to that psychological expertise, but that resource is available if we are thinking about how we're linking and partnering not only with health trusts and local providers, but also within the third sector, and thinking about linking with universities and opportunities to have people that really are keen to think about a community-based psychology approach to working creatively with a population that really need it. So we now have a team of trainees and placement students that need appropriate supervision and governance structures and access to qualified clinical psychologists, but that I feel like there's we've got quite an appetite for people wanting that experience in their training, that you can get that ready resource, and people wanting placements for reflective practices and access. But I think it's really important that there is a coherent psychological framework. That one thing that I've done alongside my SLAM work is to partner with some people to create Animo, which is a platform for having a psychological expertise and training in one place. The Mayor of London has backed a free rough sleeper mental health awareness training, which is just about to be launched in a couple of weeks. So places like that where there are ready resources, and we've got other links here, are really important, because they give you access to experts that you might not always have ready accessibility immediately. So we've got 24 experts on that training that are including Sir Michael Marmot, talking about why homelessness is individuals on stilts in terms of the levels of deprivation. We've got deprivation, then our guys are off the charts, and so it's actually how we can put that knowledge back in and make sure that everyone coherently within the system, from the cleaners and the estates teams and the management within organisations, are thinking psychologically, that it's not just about investing in the frontline staff to think about how do we understand attachment and why is my interaction with this individual crucial in everything. So having accessible training and resources and bringing them into the conversations, I think, is really important if we're going for a coherent psychological framework. I mean, there's lots we could say about that, but yeah, so that has training. Can we take that terrible picture of me?
No, we're leaving that one up.
Yeah, since I've been doing a lot of training videos, I've realised that my face, I maybe should be doing the brain injury screening, because I literally have had a stroke in every picture. It's not possible to freeze me. What's good in real life is maybe I don't stop still on any position long enough to realise what I really look like. But yes, so there's lots of training videos, so that's available for people. But I think it's about also connection, and then thinking how it's not a piecemeal approach, as people were mentioning, but that you are bringing in those expertise, and that we're making the case that it is health's responsibility to be involved, and it is all of our responsibility to be thinking about how we're trauma and psychologically informed. So at the Maudsley, I'm now working to try and think how our trusts can be psychologically informed, and we can have psychologically informed wards, because as we say, we can't have these systems that aren't integrated, or the whole system's thinking like that. As the joint homelessness team and the START team recently said in the Mayor's training, they were both saying, just because mental health teams say they don't come out and assess on the streets doesn't mean they can't. And actually that we might, in some boroughs where there's lots of homelessness, we might be more privileged to have more access to resource, but that those services are there for the mainstream, and so we can use those arguments in places where there's not that parity of access. Yeah.
Thank you. So time, is that old chestnut? But we decide what we do with our time. in a lot of ways. I think also one of the key things we need to do is talk to the people that fund us, our commissioners, and say, if you want us to do something different, you need to give us a different framework to work in. So, for example, in terms of what they expect from us, at the outcomes we're measuring, maybe. Yeah, it can be something, certainly in homelessness services, we talk about soft outcomes, which might be self-esteem, which might be engaging with services rather than a hard outcome, such as moving on into a living environment. So basically, we need to have a discussion with them and say, look, these people that keep going round and round and round the system, that we are unable to engage, not that they don't engage, we are unable to engage them. We need to think about doing something different. And in order to experiment to see what's going to work for our clients, you need to be a bit more flexible with us. So talk to whoever it is who decides how you spend your time and what you do with it. We need to be a bit more mindful of it, and also honest about what we do well, what we don't do well. And also have a change management plan. If you're really serious about doing this, as you said, it's not piecemeal, it's not little bits here and bits there sticking it together. You learnt that in the project. Change management. Get someone to help you think about how to do that. What does it really mean?
That's really important, I think, building on what the teams are already doing. And so if you're going in with a different religion, actually, no, it's about how these work together. We're not taking down your church. So actually, I think change management, there's a lovely book, Cotter's Model, Our Iceberg is Melting, a little book about penguins that realise that unlike the rest of us, that our planet is having global warming. So that's really nice, is to think how you validate what people are already doing and build on it. And how we can have boundaries as well. If we're trying to think, this word boundaries gets flown around, but how do we protect the space that we need as teams and as organisations to do the thinking and not be so reactive? If we're encouraging others to slow down, stop for a moment, then how do we, hold those spaces, not be pulled into crises and then not come to reflective practice, or, supervision keeps getting bumped when we know the importance of making sure we keep turning up for a client that we're trying to engage. Well, why don't we do that for the staff teams? So the same principles apply to the thinking around supporting teams with boundaries and time.
Absolutely, which resonates with what you said, and it is, and we all know this. And probably the reason we're doing what we do is because we feel passionately about trying to make a difference and build relationships with people. But our systems and our policies and procedures very often prohibit that rather than support it. But we are not passive participants. Yeah. We can implement change. I see it every day. It's up to us. What can we do? I personally don't think it is about the money. Yes, of course. Now, my background is commissioners. People haven't met me before, so I'm bound to say this, aren't I? But it really isn't. It helps if you have money, but it's fundamentally about a mindset and an attitude, a belief in doing the right thing. Yeah, I know that having a relationship with this individual, blurring the boundaries a little bit, taking a risk, not being risk averse. We have become so fearful. It's the way that we work and feel comfortable and being led, trusting our staff that they know what they're doing. Over to Grant, who's going to give us some examples of how
I don't know about that. I'll do my best to say something. This is Nottingham's main hostel. And just one thing I'd say, a bit of PIE I did myself. I wrote there, it's a 57-bed men. It's men only now. It was mixed, and that was something we achieved. But the big chimney at the back there is the incinerator for Nottingham. Nottingham doesn't have much space, so most of the rubbish, there's not much space for landfill, so it gets burnt. So if you are going to burn your rubbish, it actually heats the hostel very quickly. But unfortunately, the off switch had corroded, and they couldn't turn the heating off. And I can tell you that having a place that's way too hot is not conducive to building trusting relationships. Anyway, yeah, it's Pine. They have all those problems. They have no extra money. Really, it should be shut down, but there's way too much demand, and the council can't shut it down. And the staff are kind of, well, what can we do? So we're trying to do so. One thing is the walkthrough. That's something that, we can do this. They forgot, and They're doing the walk where you actually put yourselves in the shoes of a person who's going to live there and see what it feels like. That's been something useful. Looking at reflective practice. Interesting, a lot of the staff that I talked to had been there a while when we told them, we used to do this, why don't we do it anymore? So anyway, some of the other services at Framework, the organisation I work for, we're now employing a clinical psychologist. So I thought, that guy I read about, we can do it properly now. And actually, so that I was trying to get an image of what a psychologist, and on Google it always looks like a picture of a brain with things in it. So, but I thought the one is that's meant to be about attachment theory, and someone can tell me the psychologist can explain that properly. Now, and I just thought it was a nice graphic. The barriers that Anna, the psychologist we're working with, one of the things she's doing is diagnosing a lot of brain injury, which is it's just incredible. People have been in the system costing. When we estimate, we had one person who's cost all the services, if you like, the state, about £2 million. You know, so we can afford to do this actually if we were clever. But the barrier she is talking about is actually that she wants to work with people, and it's not long enough for conventional psychological work, and that does come down to trying to influence commissioners, like Claire said. I mean, in Nottingham, they've heard of PIE, they think it's a good idea, but they'll just add it on the contracts. And actually, we need to say, well, you need to take something else off and actually do things there's a really good report from an organisation called Collaborate. It's commissioning, it's a whole new world, and actually trying to get psychologically informed commissioning and changing the whole way that we're commissioning psychological service. It's not just something that's an add-on.
I think the key thing about this is that the outcomes are the same that we're already commissioned for, but we're going to get them for the people we don't normally get them for. That for me is the simple answer to this one. There are softer outcomes, but fundamentally we're going to get the same outcomes for the people that we wouldn't normally get them. What I find wonderful but frustrating at the same time, Scotland, we talked about them earlier, they've built so many more council houses. They've also committed to become the first ACE-aware nation. Adverse childhood experience aware nation. So these are the things that result in trauma. Why aren't we doing it down here? I really do not understand. So they're creating a framework of training for everybody, policemen, firemen, health, whatever. Also in Wales, this is going on. They've developed a 3-day PIE training programme. Again, why aren't we doing that here? Why are other countries making a commitment to actually acknowledging that we need to make change and supporting people to do it? I realise that was a real whistle-stop tour. I hope you've picked up some of the things from it. And there is a paper, as I say, if you make sure that you put your name and contact details, I'll make sure you guess it. But for now, what I'd like you to do is just quickly think about for yourself a reflection. You know, what's been said today that cannot be achieved, or that you would like to achieve, or what further discussions would you like to have, or what steps would you take going forward to overcome the challenges of becoming a psychologically informed environment?